So this is going to be short and sweet. There's a lot going on. Let me back up. When I came here, it was 12 years ago now. I'm going to be honest with you, and I don't say this to scare anybody, but I want you to realize how far we've already come and the pace at which things are moving, right? People often say, like, when you're raising kids, the days are long, but the years are short. And I feel like the same thing is what I've learned to appreciate in research and development in rare neurologic disease. When I came here in 2012, that was right about when the trials were finally starting for neuromyelitis optica, right? So when I arrived here, I proposed to start a clinic for which there were no treatments for anybody, right? And so I was very excited to see these NMO trials coming along. And so Keho and I and John Rose, and we pulled the list. I said, we got to pull the list. Where are the NMO patients? Let's look at it. And also, we should probably get them together, right? This was 2012, so I had them go back 20 years. And most of those patients were deceased, right? And that does not happen anymore, right? Well, I think you saw it, right? There's a lot of people with NMO. There were people here having babies. There were people doing, so this is great. Is everyone where that condition was? And is that condition perfect? No. But that was in within my recent memory. That was 12 years ago when I moved here, right? And so what I hope you're seeing is that for everyone else, we're getting there. And when it starts, it goes quickly. And again, it feels like the days are long, but at the end, the years are short when it comes to development. So I have slides. I'm going to throw my disclosure to you just because I didn't get to tell you some of this stuff. I think some of you saw this. You all have a voice for whatever you feel you've lost, whatever you have lost, however it feels from day to day. You all have a voice, and that is absolutely critical. And I do hope that you feel more empowered to use that voice, not just with your care team on the day-to-day struggles, but within the greater world, right? We are very connected. Use those technologies. No one stands to benefit more from the amplification that comes with those technologies than the rare disease community, right? So one thing that I have that up there for my disclosure, so you can see some of the stuff I'm doing, but is that Neurology Podcast, Neurology Minute. That's my side gig. A lot of you know that. That is the podcast that the neurologists in the entire world listen to. It is the most listened to podcast. It is free to everyone in the world. It is targeted. The conversations sound like they're to a neurologist, and it is to your neurologist, but that's free to you, right? So you need to listen to those. We have discussed everyone in this room on that podcast, and usually in many more than one episode. Not you specifically, but the conditions and the questions you're dealing with. And if you listen to that and you go in to your doctor, you now know the state of the art, right? So please do that. Anyway, again, we still have a lot more work to do. This was on Jeopardy. This was a couple years ago on Jeopardy. All the geniuses on Jeopardy, right? Firing off those answers before I can even read the question. This is about autoimmune encephalitis. Susanna Cahalan chronicled her descent into madness while struggling with an autoimmune disease in this 2012 bestseller. Everyone got it wrong. On Jeopardy. She is the patient advocate for the autoimmune encephalitis, the NMDA trial, right? We have a lot of work to do. If all the geniuses didn't get the question right, she wrote a New York Times best-selling book. There's a movie. They still all missed it, right? Because more of us need to talk and talk louder, right? And so, yes, I think we all can appreciate, because you're in here, wow. These things are more common than we previously thought. Some of you have realized that people in your neighborhood are here, and that was one of the goals here too. We have the ability to get you closer in your diagnosis. Make sure your team is always still asking questions. You should never go to a visit where everything is settled. So, well, this is what you have. This is where we're at. Always asking questions, always going to the next thing. Okay, we think this is what you have. We're pretty sure that you still have this. Okay, what's next? What are the top? What's the top thing bothering you today? What do you have any other concerns? Has something else popped up, right? And for those of you that I'm privileged to see in clinic, always go, and how's the family? Anything come up in the family, right? But this is how we learn. This is how we develop. This, again, not to date myself too much, I finished residency in the middle of this chart. This was not that long ago. Everything to your right in the chart was not described or discovered. These are neural antibodies and the rate at which they are being discovered. Several of yours are up here. Not all of them are, right? This is how fast things are going. So please know there is just a ton of hope, and there is speed in discovery. We are getting closer and closer. I know some of you, I've seen you once, and sometimes a year and a half goes by. Sometimes it's my schedule. But other times you show up and you say, I had to take a break, right? I just had to take a break. We get it, but keep checking back in. Keep asking the question. Keep doing it because it's moving quickly, right? And keep telling your story, right? You are teaching us, right? Doctors come, doctors go. You're still here, right? You're moving the field forward. You know, it is you. I know you don't have the energy to do it every day, but even if you have the energy to do it just one day out of the year, this is what I would ask. If you have one good day where you got a little, maybe somebody just irritated you. Maybe you got off the phone with the insurance company, got a little feisty anger going. 10 minutes. I just did this. It only took me 10 minutes with all the technology to contact every single Utah congressperson and tell them they had better not cut the research funding and they better speak up for us, right? It took me 10 minutes, right, on one day, right? And so this matters. Or maybe I go on LinkedIn or whatever social media I can figure out that day and say, hey, by the way, did you all know that this condition's a thing? And this is out there, right? And somebody sees it, right? So I think this is important to share your story. Not just share it with your medical team, share your caregivers, but please continue to do that. I hope that you have realized that every voice that has spoken up today has had something important to say. Every single voice, right? The despair, the hope, the pain, the tips and the tricks. That's just, I'm so grateful to all of you for sharing it, and know that on the science end, I'm not going to go into all of it. It's moving. And the louder you are, the faster it'll move. Thanks.